Hi, my name is Marlon Santiago Granda Torres, and I'm a medical student of the Catholic University of Santiago, Guayaquil. Here we're going to talk about the Zika virus infection in pregnancy. First, we're gonna talk a little introduction explaining what is the Zika virus, which are the symptoms, and what causes in pregnant women. The Zika virus is a mosquito-borne flavivirus that was first identified in Uganda in 1947 in monkeys. The Zika virus appeared in Brazil for the first time in 2015, and more than 1 million people have been infected since then. The Zika virus is spread predominantly by Aedes aegypti mosquitoes. Acute infections can occur with mosquito bites or through sexual transmission. The mosquito lives in warm areas all over the world. And now we're going to show you a video that explains the origin of the Zika virus. That was the origin of the Zika virus. And now we're going to talk about the symptoms. The symptoms, the people with Zika virus disease can have symptoms including mild fever, skin rash, conjunctivitis, muscle and joint pain, malaise or headache, and these symptoms normally last for 2 to 7 days. The symptoms are similar to other arbovirus infections such as dengue. The incubation period, the time from exposure to the symptoms of Zika virus disease, is not clear but is likely to be a few days, like I said, to 2 to 7 days. A diagnosis of Zika virus infection can only be confirmed through laboratory tests on blood or other body fluids such as urine, saliva, or semen. And now, effects in pregnant women. Based on systematic review of the literature up to 30 of May of 2016, the World Health Organization has concluded that Zika virus infection during pregnancy is a cause of congenital brain abnormalities, including microcephaly. Also, the Zika virus is a trigger of Guillain-Barré syndrome, and the microcephaly is a birth defect that involves incomplete head and brain development. The neonatal's head is very small, so the neonatal is basically mentally disabled and they have a shorter life expectancy. The Guillain-Barré syndrome is an autoimmune neurological disorder in which the body's immune system attacks a part of the peripheral nervous system, myelin, which is the insulating layer that covers the nerves, and also it can cause fetal death. Here we have an example of what is the microcephaly, and an image that explains what is the Guillain-Barré syndrome. Here we can see that the myelin that involves the nerve is destroyed. And now a video that explains or gives us recommendations to prevent the Zika virus.
6 ways to protect yourself from Zika. With the Zika virus continuing to spread across the globe, here are some useful tips for protecting yourself from the dreaded disease. There are a number of ways to minimize the risk of contracting the Zika virus. If possible, avoid traveling to areas with reported cases of Zika. When possible, remain in air-conditioned places, and make sure to shut screens on windows and doors. When heading to areas where you may be vulnerable to infection, apply insect repellent to exposed skin. In addition, it's advisable to keep your body covered as best you can, with trousers and long-sleeve shirts. Pregnant women should use protection during sexual intercourse. Abstaining is the only way to eliminate the possibility of contracting the virus through sex. Lastly, when going to bed, use mosquito nets to protect yourself from infected mosquitoes while sleeping. In the United States, the Center for Disease Control and Prevention has reported 2,722 cases of the Zika virus as of August 31st. See a story that really should be animated? Suggest stories to Tomo News Now.
That was the video of the recommendations to prevent the Zika virus. And now we're going to talk about applications that we can do in Ecuador with this info. With all the studies and warnings of this virus that the World Health Organization at the Public Health Ministry of our country took action and developed during 2016 for this virus. Control guidelines in infants with microcephaly, Guillain-Barré syndrome identification guidelines, care guidelines in pregnancy with Zika risk, and surveillance guidelines for neurological complications. And finally, response plans for Zika. Finally, in conclusion, the Zika is one of the most likely causes of microcephaly and Guillain-Barré syndrome sweep around the world, most commonly affecting the countries with warm and hot climates because the mosquito that transmits the virus develops easily in this type of climates. Worldwide, one of the most affected countries according to the investigation and reports was Brazil. Thanks.